I'm Erin Stieber, and I'm the Vice President of Strategic Partnerships at SmileTrain. SmileTrain is an NGO that's really formed on a partnership model. Our goal is to ensure that every child around the world born with a cleft lip or palate has the chance to live a full, healthy, and productive life. And we really make that possible by supporting a very scalable model of developing partnerships in the countries where children need access to care. So rather than utilizing a mission model where a group of doctors might fly in for a few days or a week every once in a while and treat the patients that they can find, we really focus on teaching a man to fish, which is building that local capacity so that it's available to patients who need it year-round whenever they need care. And that's also really important because it allows us to not only provide the essential life-changing surgery, but ensure that they have access to all different types of cleft care that they might need, such as speech therapy, orthodontic care, pre-surgical nutrition programs, and it really ensures that there are doctors there for them, available to treat them year-round. So our goal is really to look at the developing world and where there's a real lack of resources for children with cleft care and empower those local doctors and health systems. So we really look at where there are areas of need. We have a wonderful, massive network of medical professionals around the world right now. It's about 2,200 surgeons that we work with around the world, about 1,100 hospital partners. But there obviously is still a lot of work to be done. So we add new partners by taking referrals from our existing partners, by word of mouth. Sometimes people approach us if they've heard about us and the good work we're doing. And we really look at areas where there's still a great need for cleft care and try to cultivate partners that are there. So one of the things I love most about SmileTrain, other than the incredible work we're doing to help children around the world and really give them not only their smiles, but their lives back, what I really love about SmileTrain is that we are a strategic organization. We're an NGO and we're doing good all the time, but we're doing it in a very thoughtful and mindful way. And one of the ways that we're really able to do that is to leverage technology and gather data and let that data tell a story so that we can look at what we've done, look at where it's been successful, look at where it's maybe not been so successful, and plan strategically how to scale our programs and reach more children. And this allows us to really be the best stewards of donor funds too, which is very important to us too. So we've been very committed to data since we were formed. We have an unbelievable patient medical record database that's a proprietary database that was developed for our organization. And it securely stores more than 1 million medical records with extensive information about patients, about their cleft, so a clinical diagnosis, demographic information, treatment not only for their surgery, but for speech therapy, orthodontia, all the other types of care that our partners are providing. And it's just an unbelievable amount of data. More than 1 million cleft surgery records. I can't imagine that stored anywhere else in the world. So we're very proud of that, and we're constantly using it to further scale our programs and make ourselves better. And we really collect lots of other data and utilize it on an ongoing basis. We circulate a partner survey regularly to understand our partners and their priorities and what they're doing and where there's still needs. So we're constantly gathering data from our partners and listening to them, and also understanding our patient population so we can continue to serve them in the best way possible. So because we have this incredible database of information about our patients, one of the things we can really do is look at it to tell us a story about not only each of those individual patients, but about cleft around the world, about surgical systems around the world, about barriers to care, about where there may still be gaps in patients in need of care. And so one of the really neat things we did recently was to provide this information, de-identified of course, to a set of researchers who took the information and using global burden of disease disability weights, they actually determined the disability adjusted life years that SmileTrain's programs over a period of time had averted. So they're really taking patient data, figuring out how much disability we've removed from these patients by providing them essential treatment, and then they're able to actually economically tell us how much money that's saved. They're really able to look at how much money we've put back into economies as a result of those surgeries we've done. These are people that may not have been able to have jobs before. They may have never gone to school. They wouldn't have lived full lives. And there's obviously a really, compelling story about their health there, but there's also a really compelling story about their lives, and there's an economic story too. So with this incredible data, we found that for as little as $250 that's going into these surgeries, as much as $20 billion was put back into the economy, which is just incredible. And it's just, it shows not only how important changing these children's lives are to them and to their families, but how important it is to their countries and the global economy. The findings are incredible. I mean, we've really gotten a good sense of where we need to further scale surgical programs. So countries where we are treating many children through our many hospital partners, but getting a sense of, by pulling in World Bank data, what the backlog might be, where we need to scale, where we need to do more. Through our demographic data, we can, by hospital, by country, globally, we can look at patient age data. We can look at how many surgeons we're partnering with in each hospital. Through our partner survey, we get a sense of the global barriers to care that our partners are facing providing cleft care, which not only tells an incredible story about cleft care and helps us understand how to further scale our programs, but I think it tells a really incredible story about global health systems. And I think that's data that we've been excited to share with other groups so they can use it to inform the work they're doing too. So in India, India is such a wonderful place, and it's one of our biggest programs. So we've done a massive amount for children here since the organization was formed. We've treated 497,000 children plus, and that number is obviously growing. And it's just been fantastic to see the program start, obviously, with a few hospital partners and grow to have more than 140 now. It's just a really fantastic program that's becoming more and more sustainable and helping more and more children every year. So gathering data about what has made our programs here so successful allows us to inform other countries that may be earlier in the partnership process and really take lessons learned and allow us to help more children everywhere. Cleft surgery really depend on the country. And people at different levels of poverty will have different benefits, especially different economic benefits from receiving surgery in terms of what their buying power will ultimately be, what their ultimate ability to attain education, marriage, life will be. And so looking at the need in India, we can certainly gather that data and figure out what the economic benefit here has been. And I know from looking through the data that it's quite significant. Children who have cleft lip and palate, not only have a disfigurement on their face, maybe hidden away, may never have the chance to go to school, may never have the chance to get married, may live their lives alone because there's such a stigma associated with the deformity. So to give those children their lives back, to have a simple surgery provided by local doctors in their own communities who have been empowered to treat those children is such an incredible thing to be a part of, to really see their lives transformed as they receive their surgeries and to see what they go on to do. It's miraculous, and it's just such a pleasure to get to work in an organization that's doing this important work.